Are drugs or alcohol the real cause of their suicide? Hi, I'm Jeff Jackson, and I counsel people who've lost someone they love to suicide. Alcohol and drug abuse are often present in the lives of people who die by suicide. Sometimes both are found in the bloodstream of suicide victims at the time of death. Percentages of people who fit this description vary widely depending on who's doing the reporting, but it's significant enough that we should talk about it because maybe this applies to the person you lost. But, like many issues surrounding suicide, the deeper truth may not be exactly what it first appears to be. When we hear that a high percentage of suicide victims also abuse drugs and alcohol, it leads many of us to conclude that substance abuse causes suicide. Some medical authorities even characterize it that way. The American Journal of Psychiatry states quite plainly that substance abuse increases the risk of suicidal behavior in those exact words. But as I explained in my video, What Does Science Say About Suicide?, a lot of mental health professionals are starting to change their fundamental thinking about suicide. It's quite possible that the correlation between substance abuse and suicide needs to be rethought too. Instead of thinking that substance abuse leads to suicide, it may be more accurate to say, at least for some people, that the suicidal condition is what led to the substance abuse. That people who suffer from this condition are turning to drugs and alcohol to try to self-medicate away the psychological pain that they're suffering. By extension, it's also logical to think of drugs or alcohol as a deliberate method of suicide, just like pills, even if the abuse is spread out over a long time. Surely you've heard the phrase that someone drank themselves to death. That cliche isn't usually invoked to mean something deliberate, but that might sometimes be the case. If you lost someone to suicide and alcohol or drug use was a regular part of their lives, you're right in thinking it was a contributing factor. But I always caution people to pump the brakes when they're ready to point to some external factor as the cause of their suicide. Just like it would be totally false to point to some event leading up to their suicide or the interactions they had with you or anyone else in their world as the cause of their suicide, it may be equally incorrect to pin the blame solely on drugs or alcohol, particularly given all we're learning about the suicidal condition. Now, if this has helped you make a little more sense of this, then follow or subscribe. There's more support you can find on my website, makingsenseofsuicide.health.